The federal government is reporting a significant increase in the amount of dentists taking part in their new dental insurance plan, saying that more than 75% of all oral health care providers are now participating, and specifically more than 70% of dentists are participating. This is up from almost 50% of providers involved in the program a month ago. Since the program launched on May 1st, about 450,000 Canadians have received dental care from the more than 2.3 million total Canadians who have now been approved for coverage. So, how significant is this jump in participation for this new federal program? Mark Holland is the Federal Minister of Health, and he joins me now. Hello, Minister, and welcome to the show. So, you're reporting an improvement in the number of dentists participating by a few thousand. What is it about these numbers that made you come out and make this announcement now?
Well, this is a big announcement. We were seeing a lot of participation. You go back a month ago, before we had the claim-by-claim process that we put in on July 7th, we were at about 50% of providers. In 1 month, we've gone up 25%. So that's 19,000 providers. We've gone from about 12,000 to 19,000, and that's 75% of oral health professionals. So what does this mean? This means more people served. And so you're really seeing that in the numbers. 450,000 Canadians now have received oral health care, which is huge. This means for seniors being able to have the dignity of teeth in their mouth after, in many instances, decades without having that, or getting the preventative care that they need so they don't wind up in a hospital room with an unnecessary surgical procedure or winding up with a chronic disease or illness. So this is really big news. It means we're going to be able to get that much more care for people. We still have 25% to go, so we're not finished. Obviously, I'm going around the country talking with providers.
Well, let me follow up on that, because as you say, 25% is still a significant portion of service providers that aren't accepting patients through this program yet. So do you expect that number to reach 100%? And if so, when?
I do expect us to get to 100%. 75% in 3 months is amazing. Certainly exceeded our internal hopes and aspirations. But when I'm able to go into a community, because what we're seeing is there's certain communities where folks haven't signed up. When I can go and meet with them directly and have a conversation about the program, we get a few people signed up. They see how easy it is. They see how well it works for them and for their patients. And then we see an explosion in numbers. So that's what I'm going to keep doing, going across the country, meeting directly with providers, digging into those numbers, doing that with our team. And I'm very convinced in the next couple of months we can get to 100% or near enough to 100% to not matter in the next couple of months.
So can this program still succeed if you don't get to that 100% threshold? Because you will see an influx of new patients when it does open to general patients in 2025.
Yeah, it's a great question, Brett. I mean, to me, 450,000 people getting service in 3 months just demonstrates how much it's already working. I mean, these are folks, I talk about these stories all the time, but, there was, just because I'm in Ottawa today, talk about a dental clinic, a denture clinic with two brothers, seeing a woman who didn't had the same set of dentures for 41 years, 42 years. They were plastic plates in her mouth. She's chomping food with plastic plates. You can imagine what it means to her sense of self-dignity and worth, and not let alone the health impacts, to finally have a set of teeth in her mouth.
Well,
so these are the kinds of stories we're talking about. That's what those. So are we going to be able to see all 9 million on this trajectory? Yes, absolutely. I think I had great conversations over the last couple of days with all of the associations, most of whom are exceptionally excited to see this program continue. All of them are cheering for success. This is a big program, but 3 months we've made a lot of progress.
Well, I can see you're confident about the future, but this rollout has not been without criticism. As you are aware, the Conservatives had previously accused you of botching this program from the outset, of delivering something that was broken and confusing. What do you say to that criticism now?
Well, what's confusing? The only confusion is the confusion the Conservatives are trying to create. Look, I know they don't want it to succeed. They've made that clear. They don't want people to get dental care. They don't believe in it. But there's nothing more simple. You sign up. That process has been super easy. You get a card. You walk into your provider. You get care. Providers get paid in 48 hours. We just had the head of the Dental Assistants Association come out and say that it's incredibly easy, that their members are not finding problems accessing or using the program and have no confusion. So the Conservatives are trying to generate confusion. So it's not surprising that they're saying it exists. But 75% of providers in 3 months, 450,000 people getting service. We're not done, but that's a heck of a start. And I think it's an incredible down payment to demonstrate our commitment to make sure that everybody gets the oral health care they need.
But on this question about whether or not this is confusing, the Canadian Dental Association did give you some credit for addressing their short-term and immediate concerns, but they do have concerns in other areas. For example, earlier this summer, the association said that an urgent area for improvement is the federal government's public communication about the program, and specifically about informing people that this is not a free dental plan, it's a benefit. They may still have to pay for parts of their coverage. What do you plan to do to address those concerns?
Well, sure, and that's fair, Brett. And I've been clear all the way along. Look, the dentists have their separate process for setting their fees. It would be totally irresponsible for the federal government to pay 100% of fees that it's not involved in setting. What we do is establish fees and an internal process of what's fair for taxpayers to bear. And then every dental office or hygienist office or denturist office has to make a decision based on their fees if there's a small additional cost. But the vast preponderance of cost is covered. This is deeply affordable for folks. And we're hearing that across the country for people who are able to get the care that they so desperately need that they weren't able to get to before. In terms of how we communicate that, I'm still going to be clear. I think some offices charge different amounts. Some people aren't charging something, some are. So that does create some confusion. That's a natural a byproduct of a system that's as flexible as this one is. Because you have to understand, if you're in a rural or a remote community, or if you have somebody with really complicated care, or you have an office with more overhead, they have to have the adaptability to be, to be able to be flexible for their circumstances. This partnership allows for that flexibility to exist. But what we're seeing across the board is deep affordability, a program that makes sure that everybody is getting the care that they need.
I want to ask you about the issue of consultation. Now that you have the benefit of hindsight, this program began providing care in May and it's now August, and you're finally reporting this uptake in service providers. So do you acknowledge at this point you could have done a better job consulting with the dentist before rolling this out, rather than consulting with them after to address their concerns?
Well, Brett, it would be a very dishonest person who could look back over anything they've done in their life and not seen room for improvement. There's no question. This was done at an incredible pace. But over 2 years, before me, Minister Duclos, and in my time over the last more than a year, we've been deeply engaging with all professions, denturists, dentists and hygienists, dental assistants, to really understand what they need and to, at pace, remember this is created in just 2 years, at an incredible pace, to be able to bring this program online. And there's absolutely things that I would have improved or done better. And that includes maybe trying to find different ways to engage or consult. But on the aggregate, I'm deeply proud of the place that we've gotten together. And it's been because of that consultation that we've gotten there. And it is a process of continual improvement and iterative improvement. Because this is such a big undertaking. We've always known that it was going to be done step by step. That's part of the reason why we're starting with seniors, who are our most vulnerable people, then moving to persons with disabilities and those that are under the 18. So we're gradually building this program out, and we're learning as we're doing it. And anytime you're creating, anytime that you're brave enough to try to bring something new into the world, there's going to be learning. There's going to be things that you realize you could have done better. But that should inspire a greater work and better action, and you should be contemplative of it.
Health Minister Mark Holland, we have to leave it there. I appreciate you taking the time to speak to me about this today.
Thanks so much, Brett.